I'll start my talk by telling you a story of a person called Doris. Doris is a 90-year-old lady. Previously used to be a teacher, retired, had a very happy post-retirement life for quite some time with her lovely husband and a family. But slowly her memory started to go. And after a few years of really struggling, the family didn't have much option but to have her as a resident in a home. Doris needed constant help with her personal hygiene. She was getting increasingly more and more frail, unable to recognize her children. And she also started falling on a fairly regular basis. She had lots of tests done, lots of investigations to try and understand what was going on. But a lot of the time, she wasn't very cooperative with a lot of these. It so happens one night, around about 4 o'clock in the morning, the carers heard a thud, and they went in and they found her lying near her bed. She had a little cut to her head. She appeared a bit groggy when they tried to stand her up, so they called the ambulance. The ambulance came. She didn't look particularly well. It was about 6 in the morning, so they brought her into the hospital's accident and emergency department. But because she had had a fall and they were concerned about an injury to her neck, she didn't come sitting up or lying down. She was actually bound to what we call a spinal board. She had a collar around her neck, and she was tied down so she couldn't move at all. And that is something we do fairly routinely with people who have had a fall, where we are concerned that there might be an injury to the spinal cord. Doris didn't like it. She absolutely hated it. She cried all the way in the ambulance. She came into the hospital. She absolutely wanted to get off the spinal board. She wanted to get up and move. She also wanted to go for a wee. And it was just not going well. Unfortunately, the doctors could not release her from the bondage. They kept her like that, and they got her to get some x-rays done, which didn't really help because she moved a bit. So the plan was that to give her some sedation to calm her down more, get a scan on her head and her brain. All of this continued for hours, during which time she just got more and more agitated and more unwell. And people were at their wits' end. Her family had come. They were really, really at pain to see her suffering. And the nurses and doctors could see that she didn't like it, that she was suffering, but they had to find out what was going on. I won't tell you what happened next. Because actually, a story like Doris happens regularly in hospitals, not only across the National Health Service, but across most countries in the world. There are a lot of older people who are very frail, who we try to investigate, try to find out what's the matter with them, because we are concerned about their care. However, this is only going to get worse. By 2050, there are actually going to be more people above the age of 85 than under 16 in the world. And if you look at those areas which look very red, are going to be the ones who will have most of them. And as you can see, a lot of the other countries are following suit, although there are still some countries who are unfortunate enough to not have old people who will be able to celebrate life by living to an old age. Sub-Saharan Africa, life expectancy is still about 60 to 65, some places below 60. But for those of us who are going to be lucky to live longer, it could be a different story. So, just going to ask you a quick question here. How many of you here, just raise your hands, wouldn't mind dying of a heart attack? Okay. Anybody raising hands? No, not a, okay. What about, okay, few, great. What about dying of cancer? Okay, a few very brave people who wouldn't mind dying of cancer. How many of you would like to die of old age? A lot of people are not sure, but there's some who definitely would die of old age. Okay. Okay, the problem with that, if you are lucky enough to hit 85 plus, chances are a third to half of you will develop dementia. That is currently the price we are paying for living a longer life. So old age, living to an older age, is a celebration of advanced societies. It's a celebration of technological advances, of healthcare advances, of urban planning, vaccination, education, access to wealth, it's a wonderful thing. But it does carry with it some other unintended associations. And one of the most prominent ones that is increasingly associated with age is called frailty. This is a condition where we become socially and physically vulnerable, and we are much more easily prone to developing decompensation, either because the care has gone away, or because we have developed an infection, or we went a bit dizzy because of some medicines given to control our blood pressure, and we have a fall, and then we break a hip, and then all of a sudden we're not able to go back home. Frailty is a real challenge. Some experts say if you live long enough, you will develop frailty. So, something to look forward to if you're going to not die of heart attack and cancer. I have decided when I cross 70, I'm going to start smoking so I can drop dead quickly. Because I do not want to lie in an emergency department with one of my past medical students asking me what's my date of birth and do I know where I am, because that is the fate that awaits me if I live long enough. It may not, but it equally might. So the chances are quite high. So what is the problem then? So I'll tell you, I'm going to copy a chap called Don Berwick, who was one of my gurus when I spent my year in the Institute of Healthcare Improvement in Boston. So Don uses this story to talk about the US health system, and I'll show you how it has analogies to the National Health Service. So this is, you wouldn't know it, it's in a country called Honduras, it's the Choluteca River Bridge. It was built by the US engineers, Army engineers in 1938. It was considered architecturally the most beautiful structure in Honduras. As you can see, it was kind of shaped on along the lines of the Golden Gate Bridge. It was fantastic. It was built really solid. It's like the NHS, okay? An absolute marvel, a real awesome thing, a fantastic institution built for a very clear purpose to provide high quality care for people, okay? Until Hurricane Mitch came. In 1998, okay, that bridge was built to withstand hurricanes. It did. The river shifted. That's what's happening to the National Health Service. The health service was built to provide care for people with single problems, and we provided a specialist single management solution. Increasingly, we are seeing older people with multiple problems, and we are incapable of really addressing the issues. So, the NHS is still valid, just that the purpose, the biggest care group, actually has shifted. The only difference is that Hurricane Mitch came suddenly. However, aging, the silver tsunami as we call it, has been coming on slowly for quite some time. And it's getting worse. In Leicester, we're trying to do lots of things around it. We are building a frailty-friendly emergency department. We've got lots of things happening inside the hospital. You know, we've got lots of thoughts in mind on what we can do to improve care of older people. But I'll tell you what, I was there last night till 2 in the morning. I left at 2:15 in the morning from the emergency department. Not enough, and will definitely not be enough by the time the real tsunami hits us, which is kind of beginning to. By 2020, we will be there. And I don't see anything that we will be able to achieve by that time, which is really going to make that bridge move or swing that river back, none of which are going to happen. So that is one of the problems. It's a very technical slide, but what it shows is that when there are more people in the department with multiple morbidities, the longer they spend, which is what we are seeing. But what is the issue here? The issue is that the system was designed to deliver a particular set of outcomes. So it's not that the system was wrong, it was designed to deliver a certain set of outcomes, just that the outcomes are different because the biggest section of people who need that care are different. So, issue here, all of us were pretty much born without being able to influence it. I don't know of anybody who's been able to influence how they were born. We came because of the wishes of somebody else, and we were all cute once. And all the kids we have are very cute as well. And in some ways, it's quite nice to develop systems for children because they don't have wrinkly skin, okay? And even when you change their nappies, they're probably not as smelly as that of older people. And you can see why a lot of young people aren't necessarily interested in wrinkled skin people who don't make lovely little chuckling sounds. But that's where it ends, because actually, what we need to remember, we are all headed in that direction. Doesn't matter what we think. However, we've got a choice. When we get old, we could either sit there and wait to be headed in that direction, or we could just remember we will head in the direction, but let's get on with doing something in the meantime. Something that makes our living worthwhile. Doesn't matter whether we've got dementia, whether we've got frailty. We need to mainstream these conditions and not put them away in care homes. We need to build a society that is capable of managing people with these conditions in main society. We need to have transport systems. We need to have hospital healthcare systems that can do all of that. So, another piece of work that we've been trying. So for the last 2 years, I was involved with this big group, and what we were trying to develop were outcomes. What we were trying to get to an end point, which was the beginning. So instead of saying we'll keep on doing things to older people because we can, we wanted to say we'll design systems for older people that delivers outcomes that matters to them. And the key outcome here, to me, one of the most important, is loneliness and isolation. It's not currently an outcome we really look at, but do you know you've got a 2 to 5 times higher chance of dying if you're experiencing loneliness and isolation. That's as bad as having a lot of diseases. And I am sure the treatment is not going to be half as expensive as that for a lot of diseases. So what is it that we can do as a society? Because I'll tell you what, healthcare can't sit and solve this. This is not a health and social care problem. This is a societal issue. We all need to come together to solve this. And this has to be done together. You know, one of the key things is systems redesign. If we sit there and keep on expecting the system to deliver a different result, it won't do. What we need to do is change the system to deliver a result that matters to you, that matters to me. Currently, we're delivering systems outcomes that I think is important. A lot of them, I don't know if it really is important to the older person. So we need to change the conversation. Our current conversation is constantly, what's the matter with you? Why are you here? What can I do for you? What we need to re-change that, and you need to help me with this, you need to be able to ask those questions. When you are in those settings, the question is, what is it that matters to the older person in your family? What is it that matters to you rather than matter with you? I can keep on doing blood tests, keep on doing tests, keep on giving you treatment. I don't even necessarily going to make an outcome that actually is something that you hold dear, unless we have that conversation. So you need to initiate that conversation. You can't just depend on me to do it. And that is where I think the togetherness comes in. There needs to be a lot more lobbying, lots more activation, lot more social gatherings, communal thinking around how we take this forward. And that is absolutely crucially important. So my take-home plea for you, this is like a TTO that we give out to our patients. Go home, speak to all your older relatives, find out what is it they want, how is it they want to live while they're waiting for the inevitable to happen, instead of just waiting for that to happen. And for those of you who think it's not going to affect me, I suggest you start thinking again. It will affect all of you. Come 2050, a lot of you in your 30s will be there, okay? So start thinking about it now. What is it you want to do in your life that is not just, waiting to die? And actually, while you're doing that, also think of the National Health Service. We're almost waiting for the National Health Service to kind of die, okay? Almost like living from day to day, waiting, it'll probably die. Well, actually, if we just keep on waiting for it to die, it will die, because everything dies. The question is, what can we do to redesign the service so it doesn't land up like the Choluteca River Bridge? By the way, they built another fantastic, beautiful bridge over the river. And that is what we need to think about doing. How do we morph from here and take it there? Thank you.